How much do you know about the financial aid program for cancer patients? The #1 cause of death in Korea is cancer. It is a disease that can happen to anyone. The financial aid program for cancer patients reduces the financial burden of patients and their families who suffer from the disease, thereby lowering the barrier of medical services and enhancing cancer curability. By expanding its coverage, the current financial aid program for cancer patients supports pediatric cancer patients under 18, adult medical aid beneficiaries, patients newly diagnosed through the National Cancer Screening Program, and lung cancer patients. Let's find out the ways to get the financial assistance. The purpose of the National Cancer Screening Program in Korea is to detect 5 cancer types: gastric, liver, colorectal, breast, and cervical cancer early. Were you diagnosed with cancer through the National Cancer Screening Program? Then you can get the financial aid for cancer patient. Am I eligible for the support? Of course you are. If you're the National Health Insurance beneficiaries, you can get a financial assistance of 2 million won maximum a year for 3 years. For medical aid beneficiaries, 1.2 million won of the out-of-pocket expenses and 1 million won of payments for uncovered services are provided a year for a maximum of 3 years. What a relief! If you are diagnosed with cancer through the National Cancer Screening Program, get the financial assistance and overcome the disease.
Whenever I smoke, I had coughs and chest pain. It was difficult for me to breathe sometimes.
Were you diagnosed with lung cancer with malignant neoplasm in the bronchial tubes and lungs? Since early diagnosis and treatment are essential, you should be aware of the financial aid program for cancer patients.
Am I eligible for the support?
Of course you are. If you're the National Health Insurance beneficiaries, you can get a financial assistance of 2 million won maximum a year for 3 years. For medical aid beneficiaries, 1.2 million won of the out-of-pocket expenses and 1 million won of payments for uncovered services are provided a year for a maximum of 3 years.
The more you know, the healthier you can be.
I frequently felt dizzy and had nose bleeding. I just thought it was anemia.
What if your child in middle school suddenly got diagnosed with leukemia? Do you know your child is eligible for the financial aid for cancer patients in this case as well? Really? Is my child eligible for the support? Of course! Pediatric cancer patients meeting the household income criteria and property standards can get a maximum of 20 million to 30 million won until the patients become 18 years old. Thanks to the financial aid program for cancer patients, my financial burden was reduced and my child overcame the disease as well. Please contact your local community health centers for any questions about the financial aid program for cancer patients.